All right. Welcome, everyone. Thank you so much for joining us today at our Health Equity Forum. And we appreciate you being able to jump on with us virtually. I know we usually have these as a hybrid meeting, but we have some construction happening here at the Department of Health, and also with February sometimes still being a little iffy with the weather. We felt like this was probably a good fit for today, so I hope that that works for everybody and that you're able to hear us well. And we will just jump on in because we do have a busy schedule for today. So just a quick overview. We really, again, appreciate you being here, and we want to make sure that we are using our Zoom manners. So be sure that your microphone is muted to minimize those background noises. Feel free to use any of the options for questions, comments, responses, or reactions. The health equity team here is going to be monitoring the chat, is going to be welcoming the different organizations using both the chat and also verbally. We also have our raised hand icon for reactions, and you can always email us too if something's going awry, or if you have a question or comment that you want some more follow-up on. And again, if you're participating by phone, we do recommend that you use the Zoom app, but we know that sometimes life just throws us some kind of Zoom challenge. So we appreciate that you're flexible with this today. So I just want to acknowledge the Health Equity and Racial Justice team here at the Department of Health. These are probably familiar faces to many of you all today. And want to thank them for their diligence in helping to prepare for these meetings, and also just engaging with our community outreach efforts and different health equity and racial justice initiatives here at the Department of Health. And as you can tell, usually it is Karina Limerick, our program manager, who is greeting you. Karina is currently out of the office, and so I am stepping in today. My name is Donna Perkins, and I'm the director of the Office of Assessment and Planning here at the Department of Health. As I mentioned, we have a pretty busy agenda today. We have an update from Dr. Gedin about our new violence interruption program. We have an update from Jennifer Schneider with our Disease Prevention and Management Bureau. We've got some interesting things happening in the county that we want to make sure that you're aware of. We're really excited about our main feature today, which is the Black Angels, the untold story of the nurses who helped cure tuberculosis. And Dr. Gedin is going to be interviewing our guest author, Maria Smilios. I'm going to be doing some brief legislative updates today because it is the 2024 Maryland General Assembly season right now. And then we do have some updates about Healthy Anne Arundel Day. So to get us moving right along, also too have to acknowledge this month is Black History Month. The theme for 2024 is African Americans and the Arts. And it recognizes that Black artists have historically used art to preserve history and community memory, as well as empowerment. I'm going to hand this on over to Dr. Gedin.
All right, we can skip right into the next slide. I will make this quick. We're really excited, and we've been coming back and forth with this group to share more about the updates with the violence interruption program that our gun violence intervention team is starting in Annapolis City. And so, as you all hopefully have heard previously, the Kingdom Care is the group that we'll be working with, along with the Glimpse of Paradise, to actually operationalize that program. And we'll be starting in the Eastport neighborhood in Annapolis. And so they literally just in the last 2 weeks have actually started canvassing the neighborhood. They're hoping to be in their new space, which is on the HACA property or on the Housing Authority's property there. So we really appreciate all of the partners that have made this come to life. We've shared this graph and we'll continue to share it because we really are at the implementation phase now. So the program managers and the violence interrupters have been trained. I think they're still waiting on database training to input all of the wonderful work that they will be doing that's coming up in the next week or so. And then it will be coming back to report out on how things are going, who they've been able to reach and getting feedback from the community and others. And so we really are very excited to be at this stage with this program. And we will continue to keep you updated as a part of your participation with our Health Equity Forum. Thanks, Donna. Oh yeah, here's another one. Sorry. The lighting is actually kind of weird in the room that we were in the Eastport Community Center. So this yellow tent is the night that we introduced the folks that will be working with the program to the neighborhood. So making sure that folks had an opportunity to come out, meet the leadership, but as well as the team as well. And we were fortunate that this was done on a week when Cure Violence Global was in town doing training. So they were also able to ask questions of the more national leadership from Cure Violence about how this works, what they do. And so what will it look like on the ground is the question we get most often now. There are 3 violence interrupters and 2 outreach workers, as well as 2 folks in leadership positions. And so what you see listed on the screen is each of those different roles. How are they engaging? So program leadership, building partnerships, monitoring tensions, working with the team. Violence interrupters are really to mediate conflict and respond after shootings in a community. And that's even if there's no contact shooting. Outreach workers, that supportive and wraparound services, right? This program is not meant to be and to respond to all of the social drivers or social determinants that we know lead to gun violence in communities. This program is set out to really look at high-risk individuals. Then people need other things. So how are the outreach workers helping them engage there? And then the group that we can't do it without are the community members, being willing to engage with this group, being willing to recommend folks, young people in particular, to be a part of the program and supporting events and coming out. So there's a lot of community events and community building associated with this model. And so we need the community's help with that. So I hope if there's anyone from the Eastport community on today, I hope you've seen them out in the community. I hope you're engaging and stopping to chat. I think that's actually it now. Thank you, Donna. If you want to know more, this is how you can get more information. And they're also on our aahealth.org.
Thank you, Dr. Gedin. Sorry to sneak that other slide in on you. All right, next we're going to have an update from Jennifer Schneider, our Director for Disease Prevention.
Hi, everybody. I'm Jennifer. I just wanted to provide some brief disease prevention updates for everybody before jumping into some very broad, some TB statistics. So I just wanted to remind everybody that we are still in respiratory season. It's not too late to get your COVID, your flu, or your RSV vaccine if you are eligible. This is for children and adults, so it's not too late. The health department, you can find where to get those vaccines by visiting our website. Syphilis cases are rising. We're seeing an 80% increase in all stages of syphilis in the United States. Specifically, we're concerned about that, but we're very concerned about congenital syphilis, which is syphilis that occurs when a woman gives birth. Potentially passing syphilis to their newborn. And we are seeing an alarming 937% increase in the past decade. So we are concerned. We are concerned for a number of reasons. Syphilis during pregnancy can lead to stillbirth, miscarriage, infant death, and maternal and infant morbidity. And syphilis is 100% preventable through screening and treatment. There are multiple times within a pregnancy that the mother should be screened for syphilis. And the health department, we do provide rapid syphilis testing, and those services are offered at our health centers. And that information is available on our website. So we are monitoring that very closely and seeing what we can do to raise awareness for syphilis prevention. And then measles cases, I don't know if anybody has been seeing, measles cases are increasing throughout the world and also in the United States. The United States cases are travel related. But I just wanted to remind everybody just really briefly that just make sure that all youth, all children in your life are up to date on their vaccines. The measles vaccine, the MMR measles, mumps, and rubella vaccine are very, they are good vaccines. They are safe vaccines. And so we just want to make sure that we can prevent any kind of spread of measles in our county and in the states. So next slide. So just a brief overview of tuberculosis in Anne Arundel County. So I know a lot of people, they're like, TB, like that's still a problem. So yes, 1.3 million people worldwide died from TB in 2022, and making that the second leading infectious disease killer after COVID-19. The Anne Arundel County Department of Health, we do have a TB program who they see every TB patient that comes, or TB patient that comes into Anne Arundel County. We case manage those individuals. And we treat them as well. And so we have a group of three TB case managers that provide those services, in addition to a supervisor and some support staff. So just Maryland TB statistics. So this is our TB statistics for 2021, and 2020. As you can see, Maryland ranks pretty consistently between the 7 to 8 highest incidence rate throughout the 50 states, plus DC and New York City. So this has been consistent. So this is, we are seeing TB in Maryland. So next slide. And so these are just some specific Anne Arundel County statistics. We have seen an increase, as you can see, with the active cases diagnosed in our county. In 2022, there were 4. In 2023, there was 13, and we already in 2024 have 1. In addition to cases that come to Anne Arundel County, we also get cases that are transferred to us from other states. They're being treated in other states and they move into our wonderful county. And so we assume that that work. So total cases, as you see, we're kind of increasing. We also treat latent TB infection. And so those numbers have also been on the increase. As well as B waivers. B waivers are people who are migrating into the United States, and they have to be seen by us. So we see those, and then we are, as you can see, the big jump from 2022 to 2023. We have increased our testing. That's what QFTs are. It's a blood draw to test for TB. We're increasing our testing, we're increasing our screening. And so that's why some of our LTBI or latent TB infections, our numbers are also increasing because we're doing a little bit more testing. So that's kind of what our TB stats in Anne Arundel County look like. So that's all I got. Thank you.
Thank you so much, Jen. We really appreciate the updates. All right, and then I'm going to turn this back over to Dr. Gedin to introduce our guest speaker today.
Yeah, absolutely. Thank you, Donna. And thank you, Jen. I wanted to make sure people understood kind of the context for a part of this talk, which is why I asked Jen to go through the TB statistics, because unfortunately, a lot of folks do feel like it's something that doesn't happen anymore, and that's not the case. But a few months ago, I had the pleasure of attending a conference and listening to Maria Smilios here and Virginia Allen speak about this wonderful book. And I actually have my copy here with me today. It is a really great read. First of all, I love to read. That's number one. So I'll start with that. If you're not a reader, maybe not. But this is the story, and the storytelling is fantastic. And so when you're reading a healthcare book, and so much of it, as I was reading, I thought, yeah, we still do this today, and we do this, and we're doing that. And so learning where some of these things came from has been incredibly important. But this particular story, we wanted to look for February and how to highlight Black history. And so this was a story that I didn't know as a Black nurse, the role that these women played in helping to cure tuberculosis and coming up with that cure. And so just really fascinating. And Virginia Allen, you will learn a lot more about her from Maria momentarily, is the last living nurse that was a part of this work. So she started, I think, at 16, working with these patients, and it's just a wonderful story. And so I wanted to have Maria to come here to share more about, what led her to write this, and share more about this story, because it is really fascinating. So I'm gonna take on the role of interviewing her today and asking her a couple questions about the book and the work. And I hope that you all find it as compelling as I did listening to her and Miss Allen a few months ago. So I'll hand it over to Maria to share more.
Hi, everybody. Good afternoon. Thank you for coming. It's nice to see all of you here. And thank you, Tony, Dr. Gedin, for inviting me, and to the Anne, I'm going to mispronounce it, Arundel County of Health for highlighting the story and for inviting me to tell a little bit about this book. I wanted to start off with how I found the story, how I discovered it. And then I'm going to read the first 2 pages of the book, and then Dr. Gedin and I are going to engage in a fun conversation that hopefully everybody else might, want to ask questions after. In 2015, I was working as a science editor for Springer, and I came across a line in a book that I was editing on rare lung diseases that the cure for tuberculosis was found at Seaview Hospital in Staten Island. I live in Astoria, Queens, New York. It's about 15 miles from Staten Island, but I had been there exactly twice in my life. And I was curious. I loved disease. I loved stories about disease and how it moved through, particularly New York City. And so I Googled it, and up came this article about the cure for tuberculosis and Seaview Hospital. But alongside of it was another story about a Black nurse named Virginia Allen, who was, at the time, she was 86. And it said she was part of a cohort of Black nurses called the Black Angels, who were part of this cure story. And that really piqued my interest. And so I began Googling every combination I could: Virginia Allen plus TB, Virginia Allen plus Seaview, Seaview plus TB plus Black Angels, and nothing came up. And this went on for hours, and then I returned the next day, and it went on for more hours and more hours. And 3 days later, I was immensely frustrated and highly determined to find this completely elusive person, Virginia Allen, and these women. And so on a lark, I called the Staten Island Museum, and I said to them, "Do you know somebody named Virginia Allen?" And it was like asking them, is there a subway in New York? They were like, "Well, what do you mean? Of course we know Virginia Allen, and she's giving a talk this weekend because we're having a grand reopening, and she'll be here for 10 minutes talking about the Black Angels." I took my then 4-year-old out on the ferry. We met Virginia. I heard her talk. I said to her, "I'd like to talk to you about this story after." And so she gave me her email and said, "Email me." And I did. The time she was volunteering at the Schomburg. It's a cultural institute, if you're not familiar with it. It's up in Manhattan, across the street from Harlem Hospital, which plays a big role in my book. And so she said to me, "Meet me for lunch." And for 6 weeks, we met every Wednesday from 12 to 1 at this little cafe. We sat on these cracked red leather seats, and we talked about everything except the story. We talked about books. We talked about Harlem. We talked about the Schomburg. We talked about history, what Harlem was like in the 40s. And right before I left, to get back on the train, she would say to me, "Okay, here's a little bit about the story. Now go find out more." That would have been all fine and well if there were archives, but there were no archives. And so I felt like I had this task to get her to keep talking to me. And so what I would do is I would go back and I would tell her, "Hey, did you know that your aunt was here during the Great Depression? And this is what was happening during the Great Depression. And this is what healthcare looked like." And so that was enough. And 2 months later, she said, "Why don't you come down to my house in Staten Island?" Virginia lives in the abandoned hospital complex in the restored nurses' residence. So picture this. You'll have these very large, sprawling hospital complex, lots of abandoned buildings. And right in the middle is this gorgeous, landmarked, restored nurses' residence from the 1930s. And she and about 300 other people live there. So when she walks out her door, 500 feet in front of her, she's presented with this 5-story hollowed out building that used to be the patient pavilions. To the left is the hollowed out remains of the children's hospital in this jumble of dense forest where she worked. And so this is what she sees every day. And so she invites me down to her home, and I am completely smitten. And we start walking around, and she's pointing to this building and that building. And that's how the story began to unfold. She said to me, "Tell the story." And I said, "How am I going to tell the story?" And she said, "I will let you know what I know, and then I'll give you the names of people." And so the nurse's narrative and most of the Seaview narrative has been built from oral histories, from these women's families and the community. I've tracked down Dr. Robachek's son, who he was the one who oversaw the trials, and he was the clinical director at Seaview. He gave me his dad's archives. In the archives were the names of the original trial patients, and I was able to track 2 of them down. And so their oral history is also in the book and their time at Seaview. And so that's really how the book was built. You know, this narrative, it is completely historically accurate because everything has been cross-checked in terms of if somebody said, "Oh, my aunt started working there in 1930, I was able to cross-check that with the civil lists. The thing I did not do was if somebody said to me they experienced this, I allowed that experience to be there. And then I found a way to tell you that the historical documents are showing otherwise. But I never wanted to take away anybody's actual experience because I thought that was important when you were writing an oral history. So now I'm going to read the first 2 pages to explain to you, it'll give you a nice overview of the story and exactly what transpired and why these Black nurses were called up. The call for nurses. No one knew exactly how it started or who set it in motion, but in the spring of 1929, suddenly, inexorably, the white nurses at Seaview Hospital began quitting. One by one, they hung up their uniforms and walked out. Their reasons varied. Many of them were weary of the long commute from Manhattan to Staten Island and the successive days of 12-hour shifts. Some cited the chronic mental and physical toll their job demanded, but most were leaving to escape tuberculosis, the Great White Plague, the robber of youth, the captain of the men of death, and its victims, the quote, incurable, infected, indigent consumptives. That's who came to Seaview, New York's largest municipal sanatorium. On its floors, hundreds of patients lay in iron frame beds, languishing, their bodies swarming with millions of arrogant microbes that gnawed at their lungs, kidneys, and tongues, their spines and bones and brains. All day long, they sweated and groaned and cried out. They coughed and choked and spit up blood, each hack sending swarms of live germs onto bedpans and sheets, tables, chairs, and doorknobs. The bacteria landed on walls and nightstands and window shades. It drifted under beds and down hallways, sinking into every room and corner of the ward. It was always present, swirling, lurking, waiting to strike anyone who wasn't already sick. And all it took was a single inhalation. Over the years, the nurses had watched their colleagues fall ill. They saw how their faces turned ashen, how their eyes burned from a fever that climbed and climbed, and how their skin exuded a sickly odor that no amount of washing could eradicate. Some recovered, at least temporarily. Others died in the wards where they once worked, mouthing God in heaven or no, 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 or nothing at all. These days, as the city thrummed and churned and grew, working white women had plenty of options for jobs that wouldn't kill them. Sales clerks, cashiers, stenographers, secretaries, librarians, and telephone operators who worked the switchboard at the New York Telephone Company's new headquarters, a soaring Art Deco skyscraper, the exact opposite of the dark and sprawling Seaview. As the weeks passed, the exodus at Seaview became impossible to ignore, and soon word reached the new Commissioner of Health, Dr. Shirley Wynn. A dapper gentleman who was dedicated to his job, Wynn had reorganized the city's infectious disease hospitals and was currently focused on a massive public health campaign aimed at eliminating a different disease, diphtheria, a bacterial infection responsible for killing thousands of New York's children each year. Months before, doctors had unveiled a vaccine, but previous mishaps with anti-diphtheric drugs had left parents hesitate to vaccinate their children. Frustrated, Wynn began marketing the vaccine in, quote, the same manner as chewing gum, a second family car, or cigarettes. Leaflets announcing its safety were slipped in with phone bills. Billboards and illustrated posters went up in Times Square, and healthmobiles, renovated snow removal trucks retrofitted with refrigerators to store the vaccine, fanned out into the neighborhoods. Inside, a nurse, fluent in each area's predominant language, encouraged parents to vaccinate their children. But the staffing shortage at Seaview presented Wynn with a different crisis. One healthmobiles and vaccines couldn't fix. Tuberculosis had no cure. And so Wynn now has to come up with something to fill the ranks of nurses who are leaving. And after a bunch of meetings with city officials, they decide what they're going to do is they look towards the Great Migration. They see that it's working. It's bringing up sharecroppers and farmers, and they issue a hiring call. And the call makes its way down the Mason-Dixon line, down the Eastern Seaboard, and deeper into the American South, where it finds hundreds of unemployed or underemployed Black nurses, because the same country that drew lines around water fountains and bus stations and waiting rooms also drew them around hospitals. Black nurses were only allowed to work in Black hospitals. At the time, there were only 260 Black hospitals versus 6,000 white hospitals. And so the white hospitals preferred to remain understaffed rather than hire Black nurses. And soon the nurses began to come to Seaview because what they saw was not only a chance to get out of the Jim Crow South, but to have some professional opportunities that they wouldn't have. And so that's kind of, then the story takes off from there. And, you meet the nurses that come and what they encountered, but this gives you an idea of what they were walking into on these wards. This was the pre-antibiotic, era, before any kind of antibiotic existed. And so that's kind of a broad overview, very sweeping overview of the story.
Thank you for that. I'm sure there are people like, well, what happens next? Because it's, we're all listening, like this is an episode of Reading Rainbow. And like, okay, we're gonna keep listening to you read this story, which would be fantastic. But we're gonna ask you some questions. And the one thing I wanted to start with is, what do you hope people gain from this story? What do you hope that people will learn from this?
Yeah, thanks for asking that question, because I'm going to give you a 2.5-part answer on that. I rewrote the manuscript 3 times. I first started writing it when Barack Obama was president and we were working towards a more equitable healthcare system, or we were hoping for one. And so I had that in mind when I sat down to write this story. Then Trump came into power and the country turned into this cauldron of divisiveness, and the healthcare system broke apart, and whatever was holding it together unraveled. And so I said, this can't be the same book. And so then I wrote it with an eye towards like lifting up themes of a fractured healthcare system. And then COVID happened. And so I experienced COVID where COVID ground zero in New York City at Elmhurst Hospital. I am the daughter of immigrants. I grew up in a very heavily immigrant area. And I was a mile from Elmhurst, and I saw the lines snaking around the hospital. I saw these people that were so desperately ill. I saw the nurses working with garbage bags because there wasn't enough PPE. And I thought to myself, this is really a story about who lives and who dies based on the zip code in which you live. And so I decided I was going to really amp up that theme. And so that's the theme that I stayed with in the book. I constantly straddled with, and then the frontline workers. Most of the people taking care, at least in New York City, were Black and brown workers who were considered expendable, just the way these people at Elmhurst were considered expendable. That's one thing I hope people take away, that history matters. Like when we look at these stories, we need to say, what are the mistakes we made so we don't repeat them, because we keep repeating them again and again. The second takeaway is, I'm not going to give away the ending, but it is a story of triumph. It is, in the end, it is a really heartwarming, beautiful story of triumph and women who rose to an occasion that nobody else wanted to do, to take care of people who were considered uncouth and immoral and expendable, uncultured, and they were blamed. the city had done what it was, the people were othered, not only via xenophobia, but they racialized the microbe in the same way COVID had become racialized in the beginning. And, people in Trump's administration continue to try and racialize the disease.
Thank you. My next question is, can you tell us a little bit about Miss Virginia Allen and how your relationship with her developed along the way? I had the privilege of hearing the two of you kind of go back and forth about how you did this together, but could you tell us a little bit about that? And then could you
Yeah.
tell us, do you think this book would have been possible without her?
So I met Virginia early on. She was the one who gave me, it was a gateway into the story. Virginia came in 1947. So much of the history of the story, she did not remember. Her Aunt Edna, who is the one who kicks off the narrative, never talked about her past. Her son is still alive. He didn't even know that his grandfather was a preacher. That he knew nothing. She didn't talk about the past. Her motto was, why look back when you could move ahead? So Virginia also didn't know a lot about her family. Her mother died when she was 21, and she was raised by her Aunt Edna and the other women there. So as the story unfolded, when I had gone down to Savannah, I would send her pictures. Her family's from Savannah, of where her mother lived. It kind of unfolded with her history unfolding, me like saying to her, this is part of this history. And so she became a kind of like aunt or a grandmother to me. I mean, she's seen my daughter grow up from the time she was 4 to 13. Would it have been possible without her? That's a kind of interesting question. On the one hand, no, because she was the one featured in the newspaper. She was the one who was the first one I could talk to. So no, I don't think it would have been possible without her participation and her willingness to say to me, let me introduce you to these other people who can help you out.
Can you tell us, and I didn't add this to the question list, but I think this one's important, where the name Black Angels came from?
Yeah. So the patients at Seaview used to write Christmas cards to Edna, that was Virginia's aunt, and the other nurses. And these were people who had been stigmatized and ostracized and othered. And so there was layers of, I guess you could say, ostracization. And they were sent to this place called the Pest House. Seaview was called the Pest House, to die. They were warehoused. It was a municipal sanatorium, woefully underfunded, understaffed, way up high on a hill. And nobody wanted to care for them. And these nurses did. And so they would write them these Christmas cards that said, you are my Black angel. And that's where the name came from, the Black Angels, because it came from Christmas cards.
What were the challenges that you ran into with writing this book, other than rewriting it three different times?
Goodness, there were so many of them, and it really had to do with, there was a lot of gatekeeping. There's the people at Seaview, there is a kind of museum there. And I say a kind of because it's really now become a warehouse where these things that were originally in the hospital, anything from like the elixirs and chalkboards and sutures are stored. Their patient cards stored, refused to let me in for a long time. They didn't want anybody there. They didn't think it was important. One of the guys who had been there early on didn't even believe the nurses had anything to do with the story. So access to whatever materials were there were difficult. And then part of the challenge was it's a nonfiction book. And so I can't bend time. I was like, I don't want Edna to do this. And I didn't have a choice. So I either had to omit it or find a way to write around it. And that was a big challenge for me. The other thing was like, how do I tell this full story without people getting bored, sitting in a TB ward? And so that was a really big challenge too.
What were you not able to find as you were researching the book? Was there something you really wanted to include that you couldn't quite corroborate or include?
I wish I could have had some journals or letters from the nurses. That's really what I wish. I wish I could have gotten my hands on their thoughts. There is no dialogue in the book. because there was none left from these nurses. And I couldn't, I was not going to make it up. So I wish I could have had that to put in the book. There were some letters from a nurse, Kate Gillespie, that her son had written her when he was in World War II. He was stationed in Germany. So I was able to include that, and it just filled out the section so much. But I really wish I would have had something to get into their mind of what it was like to take care of these people and the choices that they had to make, especially when they left. You know, I think a lot of people think, oh, they just got up and they left, and that was great because they were able to leave the Jim Crow South. But the thing is, those decisions never came easy. You know, they had community there, they had their families there, and they were going to this place that was wholly different from the South. You know, Edna was always, like her son told me, cold and overwhelmed. Like, you know, she came from Savannah, Georgia, and then she comes to New York City with those like blistering winds that come around buildings and lots of people like pushing this way and that way. So that's really what I wish I had.
Thank you. So how your story takes place, or the story of these nurses is taking place from 1929 to 1952. How do you think this story is reflected in healthcare today?
Wow. There are so many themes in the book, particularly about health inequities, that are so present in today. The systemic racism, institutional racism. I've heard from nurses, I sit with them, I'm not a nurse. I sit with them and they tell me how they face the same kind of violence on the wards. There is violence that happens at CVU on these wards, particularly in the men's ward. They tell me about violence, and I get emails too. People send me, nurses will send me emails and say, I just read this and this really resonates with me because I have a boss that's like Miss Mitchell. She's the white supervisor, who you know, wants me to mess up, or I am dealing with workplace violence. One woman told me a story. She was in pediatrics and she had asked a father to put on a mask and he pushed her. So there are a lot of those themes that resonate. The masking, there's a whole mask debate that goes on in the book. Who knew that it went back way back into the 30s? Their supervisor does not want them to wear masks. And then really, I think the biggest theme is the idea that a lot of healthcare workers are expendable, and people who get sick based on their socioeconomic standings are also expendable, and they don't deserve the same kind of care as people who have more means than they do. And we need to really start funding, at least in New York, those municipal hospitals, because they are terrifying. You know, my mom had cancer and we spent a lot of time at Elmhurst where that happened. And the one time she was able to go to Sinai was a radically different experience than Mount Sinai versus Elmhurst. And that's, I was very young and I was like, wait, why is there so different? You know, and that still exists today.
Thank you. Before we take any questions, I'll ask if there's any last words or things you'd want to share about this story.
I do just want to leave people always on a positive note and say it is, as I said, it is a story of triumph. It's a story of people, women who rose to an occasion when nobody else would. And it tells us that there's people always willing to do that. All of you, if you're in healthcare, thank you for doing that. We saw it in COVID and we'll see it again and again every time there's a health crisis. And even just daily, taking care of people and going to work and doing these jobs. And I think that's inspiring. With these women, what we can really see is that their efforts saved tens of millions of lives, and they were part of a galvanizing moment in history. And I, you know, hope the book will continue to shine a broader light on their story, and it will continue to move through the country. And people will know them in the way they know that, you know, Hidden Figures. So that's my hope for it.
Thank you so much for being
You're welcome.
do this today. I would recommend really anybody read it, but also the health department staff when they start talking about the early phases of contact tracing and making sure that people speak multiple languages. It's all here, even just the black dots on doors to say, oh, we have a cluster, we can follow this. Now, what was done with all of that information wasn't always great. But a lot of it lays the groundwork for so much of the work that we do today. So I think we've got just a couple minutes for questions. And I believe Alex asked folks if we have questions to drop them in the chat.
Oh, how can we help you spread? How can you help spread the information about this book? Okay, so this is a great question. Just tell people about it. You know, talk about it, let it move through your networks. If you're in healthcare, you know, you can get in contact with me. I'm always happy to jump into book clubs or to talk. You can buy the book at your indie store or on Amazon or wherever, Barnes and Noble. I will tell you, please do not buy the book with the blue cover. It says it's a paperback version. It's not, it's a pirated version. Somebody got a copy of the manuscript and they're selling it and it's bogus. The only official copy is the one that Dr. Gedin had put, that one. I will type in, somebody asked for the information. I'm going to just type in my email so you can feel free to contact me. But yes, I would be so grateful if you could spread the word, because what I really want is, as I said, for these women to receive the recognition that the women in Hidden Figures and the Tuskegee Airmen received. So.
Yeah, there's a lot of thank yous, people telling us where they're coming from. Let's see, there is a comparison here. I don't know if you're familiar with the Crownsville Hospital system, but there is a hospital.
Yes.
It's here in Anne Arundel County. So there's been a lot of comparisons there, and there's definitely a running theme for sure. And then, let's see. Do you think that as people read this book, other family members may reach out to you about their own stories, such as their mothers or aunts that may have been a part, or may have been one of the Black Angels, or knew a part of their story? Have you had anybody reach out?
Yes, actually, I've had 2 people, and I'm so excited because I was able to honor them in different ways. And I have, one of them is up on my website. I wasn't able to include all of these nurses there, but yes, people have come forward and people have said to me, oh, my mother was in Seaview. Or one woman wrote to me, she said, I think I was born in Seaview. Can you help me find out? Seaview did have a maternity ward. So yeah, that's been really cool.
There's a question here. Do you have any online interviews that can be shared on social media?
Yeah, I think actually the other day I Googled my name and I was like, oh geez, this is a lot of stuff. There is a lot of stuff out there from different talks that I've done. What I would do is go to my website, which is, I'll just type it in, it's my name. And there's a section there that says like events and or press and reviews. And I have all of the podcasts that I did. And I think they are, sorry, I was typing my name. And I think they're probably better than the interviews, but I have on there too the interviews, or you can like go and, I didn't, you know, a lot of them are talks for specific things. Yes, I am currently doing a second book tour because it was, the book came out in September and I was doing it September to December. And then now with Black History Month, Women's History Month, there's TB Week, and then there's also Nurses Week. I've been so blessed that it's gotten this other wind, and coming out at the end of the year was a little overwhelming because 2 weeks after Israel and Palestine went into war, so any kind of wings it had gotten kind of just fell apart. And then it was like all those big books, like Matthew Perry died, and then it was Britney Spears, and so they kind of swallowed, you know, the book. But I'm grateful now. So yes, I am doing lots and lots of speaking.
I would also, there are a number of different places that have had the ability to have both Maria and Virginia Allen speaking. So if you get an opportunity to watch any of those, Ms. Allen is still alive and well, and
She is.
do some of it. hear from her.
She can, sometimes like I will show up at an event and she could be zoomed in if she can't travel to the event. So that's kind of always fun. Public health crisis that were staffed predominantly by Black healthcare workers in America. If you want to call World War II, so the Nazi POWs, I don't know if people know this, America housed Nazi POWs across the country. Those camps were staffed only by Black nurses. They sent Black nurses down to staff those camps because they weren't allowed to serve in the military. So they were predominantly staffing, they were taking care of whatever ailments the POWs had at the time. So that is, the other question, is it dependent on region in the country or a national issue? That was a national issue, the POW thing. I'm not sure if there were any public health crises in other areas in the country that might have used only Black nurses. I know that the United States has been recruiting Philippine nurses since the time it colonized the Philippines in 1898. And they have this, I forgot what it's called, like a compassionate or kind of a work, it's like a pipeline. And from 1960, over 150,000 Filipino nurses have come here to work. So they do have that pipeline too.
Another one. Out of all the research for this book, what surprised you the most?
Oh, goodness. I think the most surprising thing was, first of all, that the story had not ever been told. The second most surprising thing was I was shocked by, well, I don't want to say shocked because I knew it was during a time of Jim Crow. I knew that in the North, people think the Harlem Renaissance, that there was no racism. I knew there was only because I grew up in New York City. I think what really shocked me was that only 4 of the 29 municipal hospitals allowed Black nurses to work, that it was that prevalent and that kind of systemic and poisonous. And the way they did it was they made up bogus laws. They were like, oh, we are not allowed to have Black nurses come to our postgraduate program. That was the thing with Bellevue. And so I think that was it.
Thank you so much. I think we had
You're welcome.
There's one other person in here. Myzetta is from New York and said that people often assume that these sorts of things didn't happen in New York, but absolutely did. My mother's also a nurse and she worked in a lot of hospitals that still predominantly served or only served Black patients still existed even in the 70s. And so she worked in one for quite some time. And so when we think about it being really ancient history, my mother's not that old. She just retired from nursing about 4 years ago. So it's
not. So I know you have another part of the program. And I'm just so grateful that you had me, and thank you. And I could keep talking about this all day long. Feel free to shoot me an email message. And I hope if you read the book that you enjoy it. And I just want to thank you all. And again, thank you, Dr. Gedin, for having me.
Oh, thank you. It was our pleasure to bring in. So thank you.
Thank you, everybody. Have a great afternoon.
Too.
Okay, I think I saw about 5 or 6 people already making their way to the book in the comment section. So what a fantastic feature for Black History Month. Thank you so much. So moving on, I'm going to be less exciting, unfortunately, but I will be brief. So I will try to keep this short. But what I did want to share with you is it is the Maryland General Assembly 2024 session is happening now. And for anyone who hears, thinks back to the I'm Just a Bill on Capitol Hill. So for us, it's happening in the hallowed halls of Annapolis. But we do want to just feature, because there are so many different bills that impact health equity. And so it would be remiss not to just draw attention to some of those, and also just share a few pointers to everybody about what you can do. So just a reminder, there are two chambers in the Maryland General Assembly. There's the Senate and there's the House of Delegates. They meet in Annapolis every year from January to April. Probably why my traffic is a little worse coming into the office. Maybe not. But each chamber have committees where the senators and delegate serve and review legislation. And you can see on the graphic on the right, I won't go over it too much, but basically every bill goes through a whole process. It gets read through the first reading, it gets sent to a committee, it goes through a second reading, it goes through a third reading. It then goes into, if it was in the House, it goes to the Senate. If it was in the Senate, it goes to the House. So there's just a vast process that happens, which means there are many opportunities to potentially provide input into this process. So just a few examples, just to draw attention to where we see tie-ins to health equity, and these are all things that are being discussed right now. The first two I wanted to provide as an example of bills that actually would impact or alter already existing law. So the very first one, the Maryland Commission on Health Equity. So we have a Maryland Commission on Health Equity. The bill, which is House Bill 1333, would actually require the commission to develop and monitor a statewide health equity plan. And then it also changes the membership on that commission. So it's a commission that already exists, but here's an example of legislation that would then make this commission develop a statewide health equity plan. The second bill is about the Chesapeake and Atlantic Coastal Bay Critical Area Protection Program. That is a mouthful. And that's House Bill 0233. And the reason why I wanted to feature this particular bill is it adds to existing law language to ensure equitable distribution of the benefits and burdens of development, restoration, mitigation, and conservation along the state's shorelines and having equitable representation in these processes. The last two bills I just was going to quickly feature today as examples are both bills that would establish new things. So the Senate Bill 0430 is a community health and safety works grant program. And the purpose of this grant program would be to establish funds to provide grants for investments in crime prevention strategies. And the last bill, House Bill 0728, is the Qualified Resident Enrollment Program. And they're calling that the Access to Care Act. So what would happen with this is the state would actually submit an application under the Affordable Care Act to establish this special program. And this program would be for state residents who are not currently eligible for public or private insurance. So what do we try to do here at the health department? Well, we always want to review policy with an equity lens. So always important when you're looking at legislation to think about what is the problem the bill's seeking to address? Who does this particular policy impact? Are there particular individuals or communities that would be disproportionately affected by the policy? Will this policy impact health disparities and help move populations towards health equity? And is there evidence to inform or support the policy? And just a reminder, you do have opportunities to engage if you are residents of Maryland. So there are ways to find your representatives in the Senate and House of Delegates for your district. You also can write or call your representative. You can sign up to testify. You can participate in town hall meetings. And of course, the very first one I skipped through, but always important to think about registering to vote. And just very quickly, we did want to include some tips for writing your legislator. It's important to use your own words and to be very clear about what you want them to do. Personal experience is helpful to include, and you want to request a reply. And I'm about to cough, excuse me. I'm getting choked up over legislation. And also calling your legislator. When you call, you will likely just speak with the legislator's staff person. But they can relay your message to your legislator. And again, it's great to write it down in advance just to say, here's what I want my legislator to know about this bill. Here's what I want them to do. And you can always ask for your call to be returned by your legislator. So hopefully that was a fairly painless and quick just legislative reminder since we are in the season. And I am going to next hand this over to Mindy Garrett to talk about Healthy Anne Arundel Day. Oh, and first a survey. All right, Mindy, it's your turn.
Thanks, Donna. I'll be quick. I know we only have a few minutes left. Yeah, I have a couple of updates from the Healthy Anne Arundel Coalition. The first is the Building a Healthier Maryland survey. This is a survey from the Maryland Department of Health. It was set to close at the beginning of January, but what they found was that most of the people who were responding to the survey were female, white, and over 65. So we are keeping it open to collect more data from a greater part of the population. So I encourage everyone to take a picture of the QR code. I can also put the link to the survey in the chat. Share your opinion. We just need Maryland community members 18 years and older. And my next update, there it is, Healthy Anne Arundel Day. So April 7th is also World Health Day. We are celebrating for the second year in a row Healthy Anne Arundel Day. We're spreading it out throughout the weekend. There are 4 hub events throughout the county. So look for one near you, or you can also hold your own activity for your organization, for your community, something that involves nature, physical activity, nutrition, hydration, community involvement. We're encouraging using the hashtag HealthyAACO, and the Healthy Anne Arundel Coalition will spread that as well on our social media accounts. One other quick thing, if you have an activity that is free and open to the public, you can send that to me at healthyannearundel@aacounty.org, and I will share that additionally on our community calendar.
Thank you, Mindy. It seems like April felt so far off, and yet it is going to be here before we know it. But we're excited to promote Healthy Anne Arundel Day and give folks opportunities to participate. So thank you. All right, so we are at the end of our time together today, and just wanted to make sure and mention our call to action to share your health equity forum feedback using the survey link. And oh, of course, Raymond has already dropped the link in the chat. It's like he knew this was coming. Thank you, Raymond. And also, we have our communications office here helping us to make videos for the Just Health Voices series, which features health equity champions. It can share personal reflections. And we really just appreciate being able to feature our different community partners. So if you are interested in being in one of our fantastic videos to be featured, please let us know. We're happy to connect you with our communications office. And of course, there are many ways to keep in touch with our fantastic health equity and racial justice office here at the health department. Please feel free to reach out to us, follow us on Facebook, and visit our website. And I think that brings us to the end today. Dr. Gedin, do you have any closing words for the group?
Not much, just good to see you all. And I hope as we're finishing out Black History Month, you all have learned something in this meeting today, and hopefully have engaged in Black History Month in other forums as well. But thank you all for coming.
All right, thanks everybody.